want to thank the leadership for inviting me to participate in this Power Lunch series on certainly what is a major topic, not only in this community, but across the state and across the country. I want to give a special thanks to Judge Jimmy Poole, who invited me to speak and thought so much of me that he decided not to be here today. So literally, he's at the beach.
Yes, Judge Reed, I want you to know this. I was also at the beach.
But you came back.
I came back.
Now, see, that's dedication.
I came back.
That is dedication. Judge Poole, I guess, used his judicial privilege and decided that he didn't have to come back, even though he invited me to be here with you all. So I thank you for allowing me to speak to you today. And I'm going to try not to bore you with a lot of details, just kind of hit some of the high points, and then I really want to open it up to any questions and answers, any questions, and hopefully provide any answers that you may have. One of the things that I expected was to have my clicker here and the laptop. So I'm going to be going back and forth with my executive assistant, Ms. Rhonda. She's over here. Rhonda, what's your name? Ms. Rhonda Pringle, if you will. Rhonda's our executive assistant in the probate court, and so she really pulled all of this together. I did with her help. Not she did it with my help. So we're going to try to work this thing. So if you hear me kind of say next slide, I'm talking to her and not trying to push through. But we'll go ahead and begin, and I want to make sure that I'm timely. And so that's why I have my stopwatch here as well. That being said, let's go ahead and talk about mental health and mental illness. And we'll start just kind of with a definition of what is mental illness. And mental illnesses are health conditions involving changes in thinking, emotion, or behavior. And they're usually associated with distress and problems focusing on social and work or family activities. It's nothing to be ashamed of. That's one of the big things we've been trying to work on since I took office. It's a medical problem no different than heart disease, or kidney disease, or cancer, or anything else. And so one of the things that we've been trying to do since I came into office at the probate court has been to destigmatize the issue of mental illness. Next slide, please. Mental illness is common. Nearly 1 in 5 adults experience some form of mental illness. 4% have a serious mental illness, and 8.5% have a substance use disorder. Now, for those of you who are not familiar with this topic, I know I'm speaking to a lot of folks who are much more versed in this than I am, but substance abuse tends to kind of go hand in hand with people who have some of the mental illnesses because they use that as treatment. So if you've noticed some of the spread of medicinal marijuana, part of the mental illness push has been because a lot of people use marijuana to treat their illnesses. Whether they should or shouldn't, many people use that as a form of treatment because it helps them deal with the voices that they're hearing, deals with some of the other issues that they may have, some of the visions that they may have, and things of that nature. 20% of adults will experience mental illness at some point in their lifetimes. And so it's something that really crosses all boundaries, and it crosses genders, it crosses income. It doesn't discriminate in any shape, form, or fashion. Unfortunately, I think there's some cultural hurdles that we have to get over, and I'll address those coming up in the presentation. I'm just going to touch on a couple of types of mental illness. Just very quickly, bipolar disorder and depression are probably the ones I see in probate court the most. We see some schizophrenia. We don't really see as much stemming from eating disorders or anxiety, but that is certainly one that people tend to deal with in the mental health community. But the ones we see in probate court when people are coming before us for an involuntary commitment, bipolar disorder and depression by and large. Let's look at a few signs of mental illness. Withdrawal, drop in function, problems thinking, increased sensitivity, and apathy. These are just a few things you may notice about friends, loved ones, church members, colleagues, and coworkers. You kind of notice some of these things. There may be a signal that there's something that's not quite right with that person. That's not someone having a bad day. That's not someone being just necessarily frustrated with what's happening at work or what's happening in class. Those are things that you see kind of over a certain period of time. Very recently, I was talking with some folks from Maxwell Gunter Air Force Base about mental illness within the military community and how they're going about treating that, and also trying to destigmatize that within our servicemen and women. And you can imagine people who are very fit, very smart, very active. It's not very easy to say, I'm just not feeling very well. I just feel a little depressed or a little down. That's something that almost is ingrained in them to kind of push through to try to get to the next level of whatever that task is. And so that's something that a friend or a colleague really has to kind of pull that person aside to really ask them, is everything okay? No different than there again, if it was a physical ailment, if it's a sore ankle and you're limping, if you see that person kind of mentally limping, then that's the time to ask them, maybe one-on-one, how's everything going? Is there any way that I can help? Now I'm going to talk about the role of the probate court. And the probate court orders mental health services in either an outpatient or inpatient basis. We are really the last stop for mental health treatment. What we like to do is make sure every effort has been done within the community for a person to get voluntary treatment. So when we see someone in a probate court, it's for an involuntary commitment. It's because the family or friends or loved ones are at their last resort to try to get this person some help, and they think that they're going to be a danger to themselves or someone else. The probate court is always mindful of the serious deprivation of freedom that the process involves. And so we're very sensitive to locking people up. And I didn't start off with my personal experience with mental illness, but just last night I was speaking with my 84-year-old uncle whose brother was sentenced to or ordered to spend all of his adult life in Bryce Hospital. At a time growing up in rural Alabama in Perry County, where just from suffering from headaches as a high schooler, he was committed to Bryce Hospital, never to live free again. So for me, I grew up going back and forth with my mother to Tuscaloosa to Bryce Hospital, visiting my Uncle David. Uncle David had probably the hands of as soft as my 7-year-olds now, because he had been there from the time he was 15 until the time that he died. And so I'm very sensitive to putting people away, because at that time, that's what the mental health system was. You were locked up and the key was essentially thrown away. In particular, if you were an African-American male, then those metrics were even more harsh on you. And to hear my uncle talk about it, my mother over the years, was an A student, actually was in the same high school class as Coretta Scott, who many of you may know as Coretta Scott King. And they went to the same high school, great student, and all of a sudden started suffering from headaches. And after some months, my grandmother did not know what to do and went to get him help. And so the help was, well, okay, we're gonna take him to the mental health hospital. And he never came out. So in my role, I'm very sensitive to what families are dealing with when they come to us. And so I try to look for every way possible not to commit someone to the Department of Mental Health, even though it's much, much different than it was all those years ago. That said, as it relates to commitments for 2016, we had 294 commitments that were filed, or petitions that were filed, and 135 patients that were committed to a state hospital. So again, I'm always looking for an outpatient program. I'm always looking, can we continue this and maybe find another way of treating this person? If it's a substance abuse issue, can we get them help that's drug related, that's gonna help them with their substance abuse problem, or even alcohol being one of those substances that we always see. Is there a way to get them help there as opposed to putting them somewhere that's not really gonna address the issue that they need to really get solved? The average length of stay combined for a committed patient in 2016 is 23 days. We do not have any adolescent beds or any juvenile beds in this county, in the river region, period. So for some of the problems you may hear about or deal with in our public schools and teachers and for teenagers, we don't have any beds for them. So, oftentimes the families are on their own when it comes to what do you do with a high schooler, what do you do with a middle schooler who's suffering from some of these same issues. And we haven't been bold enough and brave enough to come up with the solutions. We know what they are. We just haven't been on the state level honest enough and candid enough to implement the things that are necessary to get people the help. And oftentimes what we hear in probate court and testimony is that people do not stay 23 days. They're normally there from about 7 to 10 days. So this may be a person who is running around the neighborhood, knocking on doors because he's hearing voices, he's seeing some things. Or this may be a lady who is undressing in public because she thinks that she's in her home, or she thinks that her skin, something is on her skin. It may be any of those factors. And these are people who do not have the opportunity because of lack of services to stay as long as they need to stay. So oftentimes the 23 days, it can be a tricky number because I may see that person in another month. When that family member, assuming they've let them come back to the house, or that loved one says, you know what, they're right back at it again. And they aren't taking their medication, we can't get the medication, and so we're right back dealing with that same issue. And so that process starts all over again. So the 23 days can be somewhat misleading. You see the number of people treated for mental illness last year in Montgomery County. But right now, in terms of active hospitals for mental health, we only have 3 in this entire state. We only have 3 in this entire state. And so that's Bryce, as I mentioned before, Harper, and that's Taylor Hardin. In 2012, available beds were cut from 740 to 268. That's a drop of 64%. It is abysmal the way we've handled mental health in this state and the way we've handled mental health in particular in the South. We use a lot of scriptural cliches, and we can quote scripture and we talk about the least of these, but oftentimes in our politics, we don't choose to show that. And we choose to show it on other social and cultural issues, but for some reason when it comes to taking care of the least of these, and those who can least afford these, to have resources that will help them, we haven't addressed that. And that's not just an Alabama problem, that's Georgia, South Carolina, Mississippi, Louisiana. You look at where the biggest cuts came over the last 10 years in state budgets, and you will see the SEC, the South, the old Confederacy, whatever words you want to use, has had the biggest and largest cuts in mental health relative to other states across this country. And it's something that we are really dealing with, and our law enforcement is dealing with it as well. Some of the mental health costs are the largest single source of the health industries. And so it impacts your insurance. It impacts your premiums. It impacts what you pay. It impacts how you get it. And one needs not talk to Joe Riley, who's CEO at Jackson Hospital, or Russ Tyner at Baptist Health to understand that. It has a direct impact on those things. Mental illness alone will account for more than half of the projected total economic burden for non-communicable diseases over the next 2 decades. So this problem is only getting bigger. And part of the reason why I think we're talking about it is because we want to try to address some of the solutions and what people are doing in some places. So what I'm going to ask Rhonda to do, if she will, to click on this link of Judge Steve Leifman down in Miami-Dade County, who's really come up with a tremendous effort to address this as it relates to the Miami-Dade County Jail.
Judge Stephen Leifman is the Associate Administrative Judge of the Miami-Dade County Court Criminal Division. He says mental health issues are prominent in courtrooms around the country.
Unfortunately, judges end up seeing more people in a day with serious mental illnesses in the criminal division than most psychiatrists see in a month. And that's a very sad reality on the state of affairs in this country. And every community in the United States is struggling with this issue. And so about 16 years ago, we started a major diversion program in Miami-Dade County to see if we could help keep people with serious mental illnesses from coming into the criminal system, and then when they did hit the criminal justice system, how we could divert them into services so that we could stop them from repeating through the cycle.
Lifeman says the program has been a success.
We reduced our recidivism in Miami-Dade County of our misdemeanor population from 72% to 20%. It worked so well, we expanded our program into our felony division, and our felony recidivism rate for people that complete the program, which is about 70% completed, is only 6%. That program alone has saved my county almost 40 years of jail bed days.
Lifeman says the program saves money and is a better way of dealing with mental health in the courts.
We were actually contributing to a public safety problem because people were coming out of our system still with serious illnesses, not in recovery, and they were ending up back in the system. And so if you approach us using a disease or a population health model as opposed to a criminal justice model, you get people services, they're not going to reoffend. They're not going to come back in the system. You're actually going to substantially improve your public safety.
Lifeman now works with a national organization, the Judges Leadership Initiative,
where we are going around the country teaching judges how to identify people in court who may be showing signs and symptoms so that we don't escalate a situation in court, and then teach judges what different options there are for them to offer people who have these, mental health issues. And so judges can be a big part of it. The other thing that we can do is that we have this wonderful moral authority, and we can bring people together in a community that normally may not be talking to each other about these issues.
For KRWG, I'm Samantha Sonner.
I wanted to highlight Judge Lifeman because I know he's spoken here in the state of Alabama at the Mental Health Conference, and he was Governing Magazine's Public Servant of the Year, Public Official of the Year last year, and what he's done has been tremendous, and it shows what we can do when we're proactive as a community and when we have leaders who are sensitive to various issues, that one person certainly can make a difference through their community. And so the decriminalizing of mental illness is a big part of it. The stigmatization of it is a big part of it. But you also have to have the follow through, and you have to be willing to talk to groups like this and let people know what's happening in the community and how things can really be improved. I'm going to skip through just very quickly, touch on a couple of the facts from the Montgomery County Jail. And if you see here just some of the monthly costs, the costs start to rise when you have someone who's on psychotropic medication. Those are costs that you pay for. Those are costs that we all pay for as taxpayers, and they cost the jail a lot of money. And so what Judge Lifeman was speaking to is, not only is it better for quality of life, is it better for a person returning to society not to be in jail when they shouldn't be in jail, but it's also cost effective. And so we have to make sure that as 11.4 million people are booked into local U.S. jails every year, at any given time, 750,000 of them really are suffering from a mental illness. That's a big number. And so that's 17%. And so we have to make sure that we are not arresting people and locking people up, so to speak, in jails when they really need help for an illness that, again, is no different than heart disease, is no different than autism, is no different than anything else you were born with and that you're suffering from. The budget impact on mental health, and this is where I want to get to the problem solving, and then I'm going to certainly open it up to questions as we conclude, is there's potentially a $35.2 million budget cut that's on the board for 2017. It will have a $99 million impact here in the state of Alabama. I know that's a little different than what I'm showing right there on the slide. Those numbers are 2016 numbers. And so the state would lose a $64 million match in federal funds as it relates to the current 2017 budget. So, when you get to expanding Medicaid, for whatever reason, that becomes political. I don't know how it got to be that way, but it becomes political. And you look at Alabama, folks, is a welfare state. Alabama by itself is that because we receive much more from the federal government than our tax base puts in. And so we have to be very honest and candid about what we're giving up for political points when we say we're not going to accept Medicaid expansion versus what others have done. I want to take this time right now, it's been a personal privilege, Lynn Bashir, who's been instrumental in helping us with some of the initiatives over leadership Montgomery. Her brother-in-law, Governor Steve Bashir, was very brave and very courageous in being one of the few Southern governors, as the governor of Kentucky, to accept the Medicaid expansion. And Lynn and I talked about that, and I had the opportunity to talk to Governor Bashir at that time about why he decided to do that and what the impact was for the people of Kentucky. And Kentucky's demographic, if you look at it, is very similar to that of Alabama's in a lot of ways. But for whatever reason, we didn't do that in this state. Well, you look at the budget impact and you see the amount of people who will lose their jobs, and you see kind of where the general fund budgeted in 2006, 2007 was versus 2016, you see that having a tremendous impact. That has an even bigger impact on rural communities. Lowndes County doesn't have a mental health provider. Many of Butler, Crenshaw, Covington, some of those counties, and when you go in and you factor in some of these budget cuts, they're having to cut programs. So again, these impact jobs, these impact schools, these impact communities, churches, and so forth. So you may not see it, but it certainly has a tremendous effect. Very recently, we get into some of the headlines here locally. I think Kim Class and the Montgomery Advertiser have done a phenomenal job in really highlighting some of the things that we've been trying to do as part of the Healthy Minds Network. We try to have some town halls. There have been articles about living with mental illness, and there have been some articles about some of the programs we're initiating. I want to commend the Advertiser for really highlighting this issue and really carrying it through over the last few years. It hasn't just been one article here. They've been doing that, I think, since we brought Dr. David Satcher here to our first mental health conference, and we followed that up with Patrick Kennedy, former U.S. Congressman, and then Leon Evans from Bexar County. So there are a number of things that we've been trying to do to really address this, and obviously communicating and raising awareness is one of those. Mental illness in the criminal justice system is something that is very important. I'm not sure if that link is currently working. If it's not, that's fine. Why don't we just skip past that real quick, Rhonda, because we're running out of time, and I want to make sure there's time for questions. Let's get to what can we do. If we look at the Restoration Center in San Antonio, this is kind of the blueprint for what we're trying to bring here in Montgomery, Alabama, and hopefully we can pull that link up. Hopefully you like the music. But the Restoration Center is kind of the blueprint for what we're trying to do. It's a crisis center that we're trying to bring here to Montgomery, Alabama, and to this county. It's something along those same lines on a smaller level is where we're starting, and we've been working with the Department of Mental Health on this and Commissioner Jim Perdue. We've also been working with Mayor Todd Strange and Commissioner Elton Dean. Sheriff Derek Cunningham has been very active, as well as myself, and the Healthy Minds Network with Lynn Bashir and Lene Connolly and folks from Summa Source at AUM. And so there's an active goal here to bring this center here, and we hope that by this fall we'll have a similar center to what you see in San Antonio. And so, you know, part of this is benchmarking what's working in other places, what's not working, and seeing if we can replicate some of those services here. And what the Restoration Center does, essentially, it does this. Before someone is taken to jail, before the police are called, before the sheriffs book them, they are taken to this place to see if they are exhibiting signs of a mental illness. So if they are, they certainly have the opportunity to stay in this facility until they can get some medication. If they're a little inebriated, until they can kind of become sober. And if they have anything else that can be looked at, they have all of those services on site. And so this has been a project that I think has been about 9 years in the making for them. So we're just starting out, but it is the blueprint for diversion centers from jail